is Smita Kumar and you're watching Medicircle. Today on our healthcare startup series, we have Jitin Bhasin with us. Jitin is a leader in the field of financial services. He holds expertise in multiple domains like fintech, banking, insurance, and consulting. In 2014, he was adjudged as Economic Times Young Leader. He was the managing director of Think Friends and Rupee Reading. He is now building his fintech company, SaveIn. So, hi Jitin, welcome to Medicircle.
Hi Smita, thanks for having me here.
So, Jitin, to begin with, we are talking to all healthcare entrepreneurs who are offering their products and services, especially for the patient, enhancing the patient care delivery process and also the experience, the way we consume healthcare. So to begin with, what pushed you to quit your banking job to start a fintech startup, SaveIn?
Yeah, so Smita, I have been in banking, finance, and fintech domain for several years now. And I think back in 2015, it was very clear to me that the future of this country lies in digitization, right? And I think the way the entire economy was moving, the way we could see tangible movement in the West, and typically what happens is when something happens in the West, India geography adopts it over a period of time, and we had demonetization thereafter. So I think there was an express indication that digitization is expected to be the core of growth for this country. And financial services typically have to grow at 2x the pace of overall GDP growth for any country, right? Which means that I could see that there's going to be a decisive contribution of digitized services, especially of financial services products. And hence fintech became an automatic area of interest for me. And I have been in fintech for the last 7 years now. And yeah, so I think that's the journey, and continue to build, continue to learn. So I think that's the journey.
So, Jitin, in India, like on an average, there is 62% of the cost in healthcare is borne by the patient themselves. So, how beneficial would be SaveIn's care now and pay later model?
Yeah, I think if you see healthcare in general, the spends on healthcare in India from government, I think continue to be, let's say, below par as compared to some of the other evolved geographies. And as a result of that, 70% actually Indian households end up consuming private healthcare. Yes. Either out of preference or out of, let's say, lack of options, right? And what it does is that there is a very large amount of out-of-pocket expense that is borne by Indians on an annualized basis when it comes to healthcare expense, right? And this is a very large market. Almost $40 billion is the size of the annual spends on healthcare products and services. Yes. And it's largely out of pocket, right? And I think the core idea behind SaveIn is that we want to create a very enabling ecosystem for healthcare providers and consumers, whereby we offer a pay later kind of a facility at each and every healthcare provider across the length and breadth of this country, enabling them to serve 40 to 50% higher customers with enhanced affordability, right? So today, a lot of people are not able to avail timely healthcare. They're not able to avail the quality of treatment that they want, along with the timely, the timing part of it. And we want to impact both these aspects by making healthcare accessible and affordable for a large set of people, right? So that has been the driving force behind creating SaveIn. It is India's first buy now, pay later platform for healthcare, and we call it Care Now, Pay Later.
Okay. So primarily you are solving two major challenges of healthcare, that's accessibility and affordability.
That's correct. Yeah.
Moving on to my next question, like the BNPL market is crowded with competition. So you have a lot of competitors there. So what edge or what value proposition does SaveIn's Care Now Pay Later have over its competitors?
So I think the buy now pay later market has been witnessing a very sharp growth across the world. And I think India is also following the same trend. It is almost a $6 to $7 billion market as we speak, and is expected to hit a 50 billion market size in the next 4 to 5 years, right, as per wide estimates. So if you see the large BNPL propositions today, the bulk of them are concentrated on e-commerce. So several BNPL products continue to exist in the country and actually continue to grow, which is extremely exciting for the overall ecosystem. But most of them are confined to e-commerce, whereby people can avail pay later products largely for products that they desire to have, right? So this funding is available for apparels, it is available for electronic goods and services, it is available for cosmetics, it is available for even ordering food.
Yes.
but it has never been available for healthcare, right?
That's
So
the
we have created, we have created SaveIn to actually impact true needs of people. So in the time of need, when you actually need timely healthcare, can we solve that for you? Can we provide you access to credit in a democratized ecosystem wherein you can avail the care that you need and at point of care? So how SaveIn is different in this regard is, first of all, we are an offline focused player, right? So we are going across the set of cities where we work, and we actually activate individual healthcare providers at point of delivery, which is the care, right? At, let's say, a dentist, at an optician, at a veterinary, at a hearing aid shop, at a diagnostic, at a hair clinic, at a dermatology practice, and it continues, right? So these are large, this is a very large and massive, let's say, ecosystem wherein we go to point of care and we onboard them on SaveIn Pay Later ecosystem. It's a completely digital onboarding process that we have. So this entire experience is then transferred to customers from the healthcare provider partners that we onboard. And customers visiting these providers can now avail credit within 60 seconds. We have built proprietary technology and credit assessment framework wherein we can assess the credit worthiness of a customer in a completely digital, paperless avatar. And within 60 seconds, we can determine whether we can give credit to the customer, yes or no. So I think it's a decisively different approach and go to market. We are a B2B2C company, which means we serve businesses who in turn serve customers, right? We are not looking at it from a B2C perspective because healthcare is delivered offline. If I have a toothache, I have to go and sit in the dentist chair, right? If I have a pet who has to undergo surgery, I have to take the pet to the veterinary. So these are items which are delivered in physical avatar. Hence, we are very different from the rest of the people.
So let us understand a bit more in deep down. So it's presently available only for the inpatient segment, or it's only for the OPD services? This is the first question. And if the funding and everything, it's arranged by, like, as you are having association with the care providers rather than the customers directly. So how is the finance then arranged for all these?
Yeah, so I think currently, let's say we are covering largely outpatient services. Okay. Our thesis is that in inpatient services, the amount of money that people will need is much higher, and perhaps insurance is a better product. And again, the penetration of insurance is very low. So we have a thesis there. But when we have started the business, we are focusing on outpatient treatments, as I mentioned, treatments like dental, optical care, veterinary, etc. Right? So outpatient is our first, let's say, area of focus. We want to address this market and do justice to this market. How financing happens? We basically pay the provider on behalf of the customer. Okay. So let's say if you let's understand this by means of an example. Let's assume that Sunita goes to a dentist and the dentist tells you that you have to undergo a 15,000 rupee root canal procedure to save your tooth, right? So the dentist can offer to you Care Now Pay Later product, okay, and we can assess you within 60 seconds in a paperless avatar. And if you are approved, then we pay the dentist on your behalf, and you can pay us over time as per your convenience, right? You can pay us in one single payment, or you can pay us in, let's say, equated monthly installments. So this is how the entire financing happens.
Okay. Like for all these other providers who are there in the inpatient segment, like they are all aligned with a lot of NBFCs there, arranging the finance. Whereas in your case, it's only you who are arranging the finance, and the patients are paying back to you through the hospital or the care provider.
Yeah, that's correct. So I think the market of hospitalization treatments and loans, it's a much larger ticket size, and it requires a significant amount of paperwork. It takes time. It is time consuming. So I think the way we are differentiating ourselves is on two regards. One is the delivery. So we are enabling individual providers. It's basically a SaaS, let's say, led go-to-market. So we're using a software, provide a provider access to a module through which they can assess credit worthiness of any customer of theirs. So that's the first difference. The second difference is how we are able to decide, how we are able to run the supply chain, how we are able to determine the credit worthiness and deliver the money instantly to the provider. Yes. So it's a remarkably, we are disrupting this market big time. And we believe that consumerization of healthcare is very critical. So we want healthcare to be consumed just as I would consume, let's say, a mobile phone or a TV or a fridge, because this is much more sensitive. This is much more important. And I think COVID has placed healthcare right at the pinnacle of the pecking order, right? If you're not healthy, everything else can wait, right? So I think that's our thesis, Smita.
Very, very, very true, because I think healthcare has made us all more health conscious, and the way we look at healthcare was consumed, accessed. Just like we used to order a lot of things from a mobile phone, now we want everything to be accessed through mobiles, and lot of things like as accessibility and affordability and availability challenges must be sorted out by startups like you. Uh, Moving on to the next thing, Jitin. So, in numbers, can you tell me how many healthcare providers you have already associated with work providing your care now? I mean, save later, pay later kind of a thing model, which they are promoting, and how many patients you have benefited so far?
So we have launched this product in Delhi, Gurgaon, and Noida in the new year. So it's a very, very recent launch. We've activated more than 100 providers in Delhi NCR already, right? And we continue to expand rapidly. We have served hundreds of customers across the length and breadth of practices. Our first customer, by the way, was a handsome black Labrador who had to undergo emergency surgery, and he actually was our first customer, and we could delight the pet parents by enabling access to money, which could lead to, let's say, surgery of this dog by the name Caesar. So we have already, let's say, touched hundreds of people in the limited time that we've been in the market, and we see there is tremendous demand to what we have built. So currently we are actually inundated with demand from providers who want us to activate them because all of them want to offer this product at their facility. They see that there is a very direct fitment of the product and the demands of the customer. So I think that's where we are. We intend to expand rapidly across cities. And as part of our growth plans, we are very focused on making sure that can we reach the top 15, 20 cities of India in a defined period of time, and perhaps create a network which runs into thousands of providers, right, across cities. So I think that's our vision. And if we were to do that, we could serve millions of people on a daily basis. We can touch their lives and help them lead a healthier life, right? So that's what our aim is.
Yes, I think this way a lot of healthcare facilities could now actually offer their services. Due to financial reasons, many of them they need to turn down such cases. But I think we're also opting for such a product where they can actually retain their patients and offer them the services at the same time.
That's correct.
Healthcare plans, what are the healthcare plans are in pipeline for SaveIn?
No, I think we are a let's say company which is focused on healthcare and finance, right? So healthcare plans, as in we aim to democratize how people access healthcare and can we make it affordable, right? So our first focus remains that, as I told you, can we cover top 15, 20 cities with the product that we have? The product is stable, it is growing, and it is being adopted very well. So that's the first focus. Can we add more practices? For example, recently we have added wellness practices like gyms. So we can help you fund your annual gym membership because it's preventive healthcare, right? Yes. So I think areas like, interesting practices like this, a lot of people, they want to take up gym memberships, especially at the beginning of the year, coinciding with resolutions, but sometimes they find that charges are expensive, right? So I think our focus is to make sure that we touch people through the length and breadth of their lives and their families, right? From, let's say, a toddler in your house to a senior citizen, everybody has healthcare requirements, and SaveIn aims to provide you with the right set of providers. So we want to invoke hyperlocal discovery of chosen providers. So we vet providers very carefully, right? So you can rest assured that if there's a provider on SaveIn, you will know that we have vetted the particular practice on vintage, on quality of services and products, on transparency and pricing, on customer feedback. So I think we want to just make sure that we can propagate this message across practices and across cities and touch the lives of millions of people, right? I think that's our immediate focus. And as we keep going, we will discover more use cases of the product and we will find ways and means to engage people better. But this itself is a massive opportunity.
Definitely. So last September, SaveIn received pre-seed funds from Narendra Kumar, Ankur Seth, and Satyam Kumar. So you are now backed by Combinator. So how much capital have you raised so far?
We are backed by Y Combinator. So Y Combinator is, let's say, yeah. So no, again, we continue to raise capital, and I think we are in the growth stage, and we are extremely, let's say, happy and grateful to have a very chosen set of, a very choicest set of investors to be backing us, right? So I think from our perspective, we are in hyper growth stage, and we continue to raise and continue to deploy that money efficiently for us to be able to serve our growth plans, right? So that's the stage where we are.
Okay, and in the financial backing, how are you going to expand SaveIn's presence in the market, and how will the funds be utilized?
Well, I think the utilization of funds is very straightforward for us. That we would like to expand the product and the delivery teams on our side. How efficiently we can create, let's say, distribution is also something which is very, very critical for us and very high focus area for us, right? So deployment of funds will be to strengthen the in-house teams across functions, and to make sure that we invest in expansion of our distribution, as I spoke earlier, that we want to activate the next 15-20 cities across the country and add more practices. And of course, we want to make sure that we invest effort and money in customer engagement, right? Because I think we are very passionate about customer engagement and customer retention, and I think that's something that will also remain a high focus area. So these are areas that we will continue to invest in, right, and challenge ourselves to do better at each step of our growth.
Sure. And what are like the financial figures you're planning to close at the end of 2022?
So again, I think, we wish to, let's say, touch the lives of lakhs of people, right? So I think our vision and our ambition is large. The market is, very enabling and very, let's say, accepting of what we have brought to the table. So I think we will, let it flow. But again, we aim to touch the lives of lakhs of people, and, through thousands of providers across multiple cities, right? So I think the opportunity we'll figure out together, but I think we see that it's a massive market that we have ahead of us. It's a very impressive and very engaging challenge, and we are backing ourselves to execute well.
Sure. So thank you so much, Jitin, for coming to our show and sharing your valuable time and insights with Medicircle. I hope SaveIn would definitely touch millions of lives, and especially in preventative care also, just not when we need OPD services. As you said, like gym memberships and other things would also be following. That's a good thing to know, because there are a lot of such startups who are actually dealing with OPIP services, but there are no such startups like you which are needed today, which like would be making people healthy before whatever, if they need an OP and an IP treatment care plan for that. So all the best with SaveIn, and thank you so much for joining us today.
Thank you, Smita. It was a pleasure speaking with you. Thank you.
Thank you.